Hi, so I'm here with Simon Spichak, and a journalist from in Toronto, and we're talking about his story that he recently had in the Sick Times, looking at the universe of exercise studies for long COVID. So, Simon, hi, thanks for being here. Why don't you first just tell us, what the story was and how it came about?
Right. So, one of the things that a lot of long COVID clinics and a lot of clinics for other conditions like myalgic encephalomyelitis, one of the things that they still offer is exercise, even though there isn't any evidence that it works, and there's plenty of evidence that it could cause harm. And a lot of people with long COVID have post-exertional malaise, or they might meet the Canadian consensus criteria for myalgic encephalomyelitis. It ranges, on the study up to, 50% of people with long COVID. So one of the
Right.
things that
We
got
don't,
me,
just to be clear, we don't really have a good figure on. I mean, it ranges up to 50%
yes,
or lower, so we don't really know. The
yes,
universe, depending upon how you define long COVID, what percentage it is that have an ME diagnosis and what percentage that have post-exertional malaise. It's obviously a significant number, but the exact number we don't know.
yes. I think I've seen it between 10 to 50%,
Right, which is a
depending
very,
on the
very big
publication.
range, obviously.
Yes, yes. And I think the interesting thing there was when I was doing a previous story looking at the Canadian guidelines for long COVID, they did have some suggestions for exercise with, very low quality evidence,
Right.
and none of their evidence included post-exertional malaise measurements. And what got me interested is, a lot of people with long COVID, uh, we don't know the exact percentage, but they will experience post-exertional malaise.
Right.
So is that being taken into account by the researchers doing exercise studies? And
Right.
we
So
know
the patient
from
may not realize, I mean, now if they've been diagnosed, they may realize what post-exertional malaise is, but they actually may be experiencing it and not actually having a name for it or understanding exactly what it is. And the researchers may not also, it seems.
right. The idea is if you're studying a condition and there's symptoms or manifestations that occur in this condition and you're running a trial, you should probably be aware of it, especially if the intervention might trigger or exacerbate those symptoms.
Right. If it's
For
contraindicated as it is for graded exercise therapy, say for ME, CFS. Okay,
yeah,
so what did you do? You did an analysis actually of from the database of clinical trials, yeah?
Yeah, so you can go on to clinicaltrials.gov. That's only going to be the trials registered in the US registry, but it gives you a good snapshot. And then you can basically search for every single long COVID trial that involved exercise. You can download all of those trials and you can whittle those down to get rid of any trials that, mention exercise, but that's not the intervention that's going on, or any trials that don't involve long COVID patients. So people with an acute bout of illness or people with hospitalization
Right.
that aren't specifically long COVID. And then you can run a bunch of numbers and kind of look for patterns.
Right.
So
Okay. So you found that of how many? About 100 something, yeah?
yes, I believe there were let me get the number. I think it was 112 exercise studies and only 21 mentioned post-exertional malaise in the trial registration. This is a very low bar. This is just mentioning post-exertional malaise, not necessarily measuring it, not even, measuring it correctly,
I mean, this is
right?
just a mention of it somewhere in the trial registration as a potential
Yes.
symptom. Okay.
Yes. And then the next thing you can do is you can look at the outcome measures. The other things I looked at were also was the data from these trials actually published? Because, uh, from my own experience in academia, a lot of studies that you run don't actually have the results published. There's some regulations for drug trials there aren't necessarily regulations for interventions that involve exercise. So I wanted to see if there were a bunch of people being enrolled in studies that might potentially harm them, and then those researchers weren't publishing those results in a timely manner.
Right. Although
Uh,
just to be fair, it's you know, as anybody who's published research knows, it's not fully
yes,
dependent on the authors. It can take just a year to get, to go through peer review in some
for
places.
sure.
So
For sure.
it's
The
not
the numbers we got there were similar to drug trials.
right. Okay.
So uh, I just thought that was an interesting bit to look at, and then we could look at how often post-exertional malaise is mentioned over time, and we see less studies of exercise, but more mentions of post-exertional malaise in those studies. That might be because A, the only researchers that are left running studies are researchers that, know more about long COVID or care more about long COVID now that it's not as trendy to do research on the topic, or yeah,
Did you give us actually the first of the ones that you found? It was less than 20%. I don't know if we
yes.
actually, I'm trying to remember if we
Oh, sorry.
mentioned that already.
Yes.
Less than 20% had any mention of post-exertional malaise.
Yes. 21 out of 112 exercise related trial registrations mentioned post-exertional malaise. Only 14 of those trials assessed post-exertional malaise. Two of the studies excluded participants with moderate to severe manifestations. Another two excluded any participants with post-exertional malaise.
Hmm.
And a lot of the studies use the DSQ PEM measure.
Okay, so
Uh,
explain what that is, the DePaul symptom questionnaire.
yeah. So that's a very popular questionnaire that's developed as a screening tool for myalgic encephalomyelitis because it detects post-exertional malaise. And this is like one of the sub-questionnaires that's basically administered that can, detect at a certain rate if someone's likely to have post-exertional malaise.
Right.
It's not a perfect tool. It's not necessarily designed, to measure, did this thing make someone necessarily worse when you're just doing it before or after, and there's some limitations to it that are mentioned in the article.
Right, and it's a screening tool, more to see if if someone, at some point has a PEM, rather than, as you say, an assessment tool exactly of the severity or so on and so forth.
Yes, yes.
Okay, so you found a minority used it. So what do the overall findings suggest to you?
I think that the overall findings are that researchers aren't really listening to patients, right? Because this is something that, if you go online or if you talk to any patient groups or if you include them as patient partners to help you design your study, this is something that they're going to point out right away that there's the potential for harm. And if you do end up running this trial, there needs to be a really good reason. You need to try and minimize those harms, and you need to really, measure what's going on and track that, you're not actually making the patients worse by the end of the study. The other thing is the idea of exercise. It really seems, as Jamie Seltzer told me, it's really insulting to tell someone that, the only reason you're not better is because you didn't figure out this really obvious thing that you should be moving more.
Just be clear, Jamie Seltzer is with the Emmy Action,
Yes,
scientific director, I guess, I think is her title.
yes.
So I'm sorry. So she told you again. Why don't you say again what Jamie told you?
Right. The idea that, people haven't figured out themselves that, the solution is just exercise more is a little insulting. I think it's pretty obvious for anyone who's experiencing post-exertional malaise that exercise isn't going to fix the problem. And exercise here is being presented as a solution when it doesn't really fit any of the mechanistic frameworks that have been provided as explanations for long COVID.
Well, I mean, it's basically based on the notion, or it traditionally was based on the notion that people are deconditioned, and that the symptoms are arising from the sort of condition of extreme deconditioning, and that therefore exercising will reverse those symptoms. That's sort of the explanation in the PACE trial and so on. So that's the rationale.
Yes.
If patients aren't in fact deconditioned, or if that's not the cause of their symptoms, it doesn't make a lot of sense.
I did ask some of the investigators from the Recover Energize trial what the rationale for the study was, but they declined to comment.
hmm So you just to explain, the Recover Energize trial is the exercise trial being done under the Recover initiative in the U.S.
Y yes,
Okay.
yes, and I believe they're aiming to recruit. They were originally aiming to recruit 300 people. A lot of patient advocates and researchers, criticized the trial. The investigators eventually added a pacing arm. They updated the inclusion and exclusion criteria, and the sick times was at one of the long COVID meeting sessions with the Recover team, and they asked a question about why they were continuing the study despite the criticism it received, and they basically responded that the researchers working on the trial still felt that it was a valid question to answer and an important treatment to evaluate. So that's sort of why I followed up to ask them the rationale, of why they think it's an important question to answer.
hmm Well, I mean, is there a sense that it might be an important question for those who don't have post-exertional malaise? I mean, is there do the people you talk to, the researchers you talk to, see a problem with exercise trials if they specifically exclude people with post-exertional malaise?
Oh, well, I think the issue is we don't have any strong evidence for it either, right? And
hmm
I also talked with Matthew Derstenfeld, he's a cardiologist running a 20-person pilot exercise trial. It was originally just for people with chronotropic intolerance and chronotropic incompetence and long COVID, but they eventually expanded it to people who didn't have PEM. And the idea is that there's an issue with the heart being able to, you know, uh,
And
pump
can you explain what
efficiently.
chronotropic incompetence is?
Right. So let me get that. So the basic, as I understand it, with chronotropic incompetence is that the heart isn't able to properly adapt to increased physical demands. Right? So the when you want to do something, the heart isn't able to adapt to it, and maybe that's why, people with long COVID experience fatigue. That's sort of the original rationale for the study. It was supposed to be 20 people. They were having some trouble recruiting. They eventually expanded it to include some people with uh, long COVID who don't have chronotropic incompetence, though.
But so wait, what does it have to do with post-exertional malaise? And
I that's sort of the challenge. They're screening out people who have post-exertional malaise, and I think the idea here is that it might be beneficial for some people who don't have post-exertional malaise,
Mhm.
based on this chronotropic incompetence and based on the idea that a similar pilot trial worked in people with HIV. But again, exercise isn't the primary treatment for HIV, where you have antiretrovirals. So,
Right, so you're suggesting that in these studies it's being used as the primary treatment, as a curative treatment essentially, or potentially curative treatment, as opposed to even where it's being trialed and they are taking into account it's being used as a primary treatment and not sort of as a supplemental kind of a thing that might help people on the side.
I think that the issue is that you're going to have long COVID clinics that take these small pilot studies. These studies are biased or flawed, and they're going to use them to offer a therapy for people with long COVID. And we already see that in long COVID clinics. So, in a sense, it doesn't really matter if the study is intending to be used as a pilot to see if there's an effect, because there are going to be long COVID clinics that are going to use this as evidence to sort of support the idea of exercise to their patients.
Okay. 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 Thank you, Simon. I appreciate anything last thing you want to say uh, in terms of that.
Yeah, uh, I think that there's just no really strong evidence that I see or that I found or that, any of the researchers have presented that exercise might be something worthwhile to spend all of this money on when you have a lot of patients that are very sick and that are demanding, that are demanding trials that might actually provide new experimental treatments that might have more of a benefit and that won't induce post-exertional malaise.
Okay. Okay. Thank you, Simon. I appreciate it.
Yeah, no problem.